Metastatic breast cancer means that your cancer has spread beyond the breast and beyond even the lymph nodes to other parts of the body. It's really important for you to talk to your care team about your metastatic breast cancer treatment so that you can understand how it's going to impact your quality of life and what those therapeutic goals are going to be. It's really important for you to write down those questions so that you can understand not only your treatment goals and your stage, but your quality of life, your endpoint, your scans. So, when you write down those questions, you're going to get more answers and have a better conversation with your doctor. Some common questions you might ask your team about your treatments for metastatic breast cancer might include things like, how long will this treatment last and how will we know it's working? What scans do I need and how often? Are there any promising therapeutics on the horizon? Are there any clinical trials that I could participate in? How will this affect my quality of life? Will I be able to work? Will I lose my hair? Will this impact fertility? Do I have any restrictions in my activities or in my ability to socialize with family and friends? Cancer therapeutics can be very expensive, especially those that are more targeted therapies that are emerging in the marketplace. A patient who's metastatic may be in treatment for a very long time, and those costs can really start to add up. It's really important for you to talk to your doctor and understand the finances of your treatment so that we can make sure that you're able to afford the most effective and most cutting-edge treatment for your disease. It's always important to be honest with your team about what you're feeling and the side effects that you could be having from a therapy. We need to know so that we can know if we need to change the dose, so that we can maybe modify the frequency of that medication or even switch to a different medication, because sometimes there are different options within a class of drugs. But if we don't know how you're feeling, then we're not able to help with that, and that can really impact your quality of life. A patient navigator is typically a nurse. They serve as a point person to answer questions. They serve as a resource for you as you have additional concerns about your care, and they can relay those to the provider. And so they really serve as a person who is designed just to help you along your cancer journey. Not every center has a navigator. There are some studies that show, in particular for Black and Hispanic women, sometimes they get their care in centers that don't have all of these resources. Talk to your oncology team and ask about that. Is there a navigator? If they're not in the center, is there one in the community? Many advocacy groups as well offer free navigation services. Finding a really good team who understands your goals, who asks you what your wishes are, is a great place for a person who's diagnosed with metastatic breast cancer to feel like they're getting the best care.